pain can lead to options like spinal fusion to stabilize the spine, and advanced treatments include using our own cells to improve results.
Yeah, how interesting. Joining us this morning, Hartford Healthcare neurologist Dr. Vijay Yanamadala with St. Vincent's Medical Center to tell us more and how it could benefit you. Doctor, good morning. Thank you so much for being here.
Good morning. Thank you very much for having me.
Yes, good morning. And we were just chatting in the break about how you were actually the first to perform the procedure at St. Vincent's. Talk to us about this.
Absolutely. Thank you so much. So, spinal fusion, as you mentioned, is a common treatment for back and leg pain that happens because of nerve impingement, nerve, compression in the spine. And oftentimes, what we've had to do up to date is to use bone from people who've donated their bone, or bone from people's iliac crest, which is part of the hip area. And that can cause a lot of pain when we actually need to take a piece of your own bone to help a fusion heal. Because the key part of a lumbar fusion is to actually let the bones heal together so that they're no longer causing pain. The key here is what we're doing at St. Vincent's now is using your own blood-derived factors, what we call platelet-rich plasma, platelet-rich fibrin, that allows us to actually promote bone healing without taking a piece of your iliac crest or using bone from people who've donated their bone. So the studies today show that this is as good or better than any of these other types of things to promote fusion.
Doctors, does this procedure speed up the recovery process?
Yes, it does, tremendously. You no longer have the recovery from harvesting bone from your iliac crest. And we also know that this speeds up the time for those bones to heal and fuse.
And I know that you've done this several more times since the first, but can you tell us about that first patient case? How is he or she doing today?
Absolutely. So this was now more than a month ago. This patient came to me with severe back and leg pain. We had tried really everything: physical therapy, acupuncture, injections. None of these things were working. So finally, I put him through a lumbar laminectomy and fusion and used Fibrinet, the platelet-rich fibrin matrix, to help him heal. He is doing very well. His back and leg pain are essentially gone now. He's walking, much more than he was before. He was barely able to make it to his mailbox before surgery. Now he's walking several miles a day. So I'm very, very pleased to see his progress, and I think that he will continue to make progress in the coming weeks and months.
Doctor, very impressive there. Now, who can benefit from this procedure? Is it pretty much everybody, or is there a certain type of patients that you target here?
Yes, absolutely. Pretty much anyone who is undergoing a lumbar fusion now can benefit from this, and that's how we're using it. Again, my philosophy as a neurosurgeon, as a spine surgeon, really starts with how can we get you better without surgery first, getting you better through physical therapy, injections, and other means. But ultimately, if you need surgery, this is a technique that will speed up recovery and make the outcomes all that much better.
Wow, it feels like this is life-changing for those folks, especially that patient you were telling us about. Very interesting. Doctor, thank you so much for your time today. Appreciate you joining us from St. Vincent's to tell us all about it. Thank you.
Thank you so much for having me.
Thank you.